Part of our prevention program here involves doing advanced testing. Specifically, today we'll talk about heart attack, stroke, and diabetes prevention. Two of the biggest tools that we use are Berkeley Heart Labs and Boston Heart Labs. We'll discuss Berkeley Heart Labs first. Here at FamilyWise, we offer a genetic test. It's a cheek swab, and based on your DNA, there are three main genes that we can look into to see what your risk factors are. The first is the LPA genotype, the second is the KIF6 genotype, and the third is the 9p21, which is the early heart attack gene. With the Boston Heart Lab test, it offers more than your traditional lipid panel. Lipid panel most often gives you your total cholesterol, your HDL, LDL, and triglycerides. With the Boston Heart Lab test, we look at particle sizes, which are very important. Our small dense particle sizes most often are the ones that cause inflammation to the arterial wall. When there's inflammation to the arterial wall, that leads to increased white blood cells. When white blood cells go into that area, that forms plaque. And so our main objective is to decrease that inflammation, and using the markers in the advanced test give us a head start in doing so. Apart from that, there is a specific test called the plaque marker to show how much inflammation is in the arterial system and if you're starting to make soft plaque. The Boston Heart Lab test with the Berkeley Heart Lab test give us a great resource to proactively treat these things. That coupled with CIMT testing, which involves scanning the carotid arteries, helps us be proactive. For patients, the advanced testing is important because there's a lot of risk factors that we don't know that we have. Family history is certainly a big factor, and with your medical history we can see if there's anything in the past that will predispose you to these problems. But there may be some things that we don't know, and so looking at the advanced test lets us look at your genetics to see if you have some underlying risk factors. As an example, most people know about bad cholesterol, but most people don't know that if their cholesterol is in a normal range, yet they still have the small type of particles, that's just as dangerous as somebody whose cholesterol is 10 times as high as it's supposed to be. So getting more specific testing helps us, again, be more proactive instead of kind of waiting and reacting to a problem that occurs down the road.